Hi everybody, my name is Jim Fisher. Sorry about the crazy hair and the long untrimmed beard here. I'm not quite as hygienic as I was before all this. I used to work professionally in behavior health, mostly with autistic people and their families, children and adults. So I'm making this video today because I was floxed, or you might say I reacted very poorly to a fluoroquinolone. Flox is a term that the community uses for those of us who have been adversely affected by a fluoroquinolone drug like ciprofloxacin or Levaquin, commonly known as Cipro. I took Cipro. It's been 8 weeks today, so I'm at about 2 months from when I was prescribed the Cipro. I was also on a script for glucocorticoids. It's a steroid called the methylprednisolone. It's similar to prednisone. It's the same, basically the same drug. I'd been on steroids for about 6 weeks. As those of you know, and some of you folks who don't, steroids are contraindicated with fluoroquinolones. They tend to moderate the effect of things like tendon rupture and tendon damage that can be caused by Cipro. They can magnify it and make it sometimes, it's increased by an order of magnitude, which means it's bad news to take them at the same time. Of course, I didn't know all this when I was prescribed the drug by a urologist for a possible prostate infection. There was a negative culture on that. I'd had some chronic pelvic pain there for a few months without a diagnosis, so they were trying to give the antibiotic a shot to see if that would help. Good intention, polite doctor, but in my opinion, it was negligent to prescribe that drug to me. He was informed of the steroids that I was also medicated with. These are not supposed to be, these fluoroquinolones like Cipro are not supposed to be given to populations of people over the age of, I think, 60 or 65, to folks that are being treated with steroids, because those particular populations are at an even higher risk of symptoms and adverse reaction, particularly the tendinopathy, which I have, which is why I'm seated in a chair and why I look like, some kind of a rabid lumberjack. I haven't bathed quite as frequently as I used to. Things like getting to the bath, showering, shaving are much more difficult than they were. Sometimes just even making it to the bathroom there for the first month was very, very difficult. I crawled for a month. Basically, within 7 days of the first pill, I only took one pill. It was a 500 milligram, which probably it's a very bad thing that I'm so sensitive to the drug, but it's also probably a very good thing because I noticed within 3 hours of that first pill that something was wrong. Hopefully some of this will help as I'm sharing with you, those of you who have taken the drug, or those of you who may take the drug, or those of you who know someone who have a loved one prescribed these antibiotics. Within 3 hours of the first pill, I experienced joint pain and fatigue. So I kind of laid it down for a few hours, wasn't feeling right. Something wasn't right with that drug, and I knew it wasn't the steroids that I was medicating with. I'd been on those for a few weeks, and I was used to the side effects of those meds. And other than some supplements I was on, there was no other reason to have that sudden onset of joint pain and the lethargy. So I looked up Cipro and the side effects, and of course there was a lot of horror stories. And I had a lot of fear that something was going on, so I discontinued after the first pill. So that's right, I only took one pill. The rest of the script is actually over there now by my bed. I've kept the bottle. I still have all of it except the one pill. I called the prescribing urologist the following business day, reported the symptoms, and told them I was discontinuing and perhaps try me on a lesser antibiotic such as Bactrim, which is a different class of antibiotic. That's what they did. I completed the Bactrim. I still had the pelvic pain. It didn't really help anything. It was worth a shot, I suppose, but the Cipro is the problem. As you've probably read up on some of the, as you probably read up on some of the FDA reports and some of the stories and some of the research available on fluoroquinolones, you'll see that a frontline use of that drug, or a first line use, which is to say nothing else has been tried, and it's not even certain that you have the infection. If they're just trying to possibly treat something that they're not even sure you have, and they haven't tried anything else first, like a lower class drug like Bactrim or amoxicillin or something like that, then you shouldn't be prescribed Cipro in the first place. So this is very, very important. If you're given a prescription of Cipro for something like a UTI or prostate or sinus infection or respiratory infection, and you haven't been given options to anything else, nothing else has been tried, or if, in my case, you got a negative lab back on a urinalysis that didn't even indicate an infection in the first place, you should really avoid this drug. This drug should be reserved for serious infections that haven't responded to other treatments. I would even go so far as to say, certainly in my case, a life-threatening issue. And even then, I'm not sure that I would agree to Cipro, because the damage that it's caused is the most difficult thing I've ever experienced in my life at 40, or I'm 39 years old. Never been through anything like this. I didn't have a medical history up until January of this year. It's 2018. So this was a few months out. Really didn't go to doctors. I was that guy. I was very healthy. Didn't treat. Hadn't had a pharmaceutical med in 20 years. Very careful. I was careful about my diet. I was a runner. I was a weightlifter. I weighed about 230 pounds. At 37 years old, I ran, 13-mile half marathon with a backpack on. This was just 2 years ago, so about 10-minute miles. It wasn't real fast, but for 37, considering that I was cross-trained, I was in very, very good shape for my age. This all went downhill with the pelvic pain, but then when I took the Cipro, this was a watershed moment, because the Cipro was essentially like pouring gasoline on a fire to put it out. It essentially, was like a bomb going off in my body. It was, it was horrible. So like I said, by the first day, so we'll get back to the symptoms, I began to notice the fatigue, the joint pain, which I'd never had before. I'd never had problems with my knees before. Nothing like that in my hips, and in my ankles was where I was noticing the problem. By the third day, I was on the Bactrim at that point, and had only taken the one Cipro, so at 72 hours, I was beginning to notice some tendinopathy, or I guess you'd call it tendinitis. The distinction is inflammation. It gets technical, the distinction between tendinosis, tendinitis, and tendinopathy. Tendinitis is, I guess you might say, the milder of the three. It typically indicates an inflammatory response, although it's not necessarily the case if you follow the literature that you have inflammation in the tendons. At any rate, I was noticing some tingling and some weakness in my Achilles and peroneal tendons. And peroneals are the outside tendons. So when your ankles are rolled, if you're playing basketball, you're walking in the yard and you roll your ankles and have some pain, those are the peroneal tendons that run behind the ankle bone. And then the Achilles is sort of the main one, of course, that runs from the calf down into the heel. So I was beginning to get some popping and cracking back there. Felt a little bit neuropathic. The tissue felt a little bit weak. It was not really painful, but because I'd read the stories about the Cipro, I was alarmed. So I stayed off of my ankles. And by staying off, I mean I literally ceased everything and laid flat on my back in bed, more or less for, I don't know, a few days, and only walked to the bathroom. Didn't even go to the kitchen, really, because I wanted to really be careful and try to prevent any sort of issue that could come up. It didn't help. By the 7th day, the beginning of the tendinitis had progressed to the point where it felt like, especially the peroneals, but also the Achilles tendons in my ankles were extremely weak. They felt like mush. My ankles were sort of kind of bowed in while I was just standing upright. And I was healthy enough before this. I mean, I could walk, I could go to the store, I could drive, I could go to doctor's appointments, go to the park, and at least make it 100 feet to a bench. I didn't have problems in my ankles. I was only treating for a pelvic condition. My body wasn't in the shape it had been previously, but I'd had none of these issues up to that point. So by the 7th day, the tendinopathy was so progressed that I couldn't support my own body weight. It was very painful. There was a lot of what I felt like neuropathy at that point. It was tingling. It felt like an electric current was going through the tendons. It was popping and cracking all along the tops and bottoms of my feet and my heels and my toes. But of course, what felt like the most severe issue was there in the tendons in the back and the Achilles and peroneal tendons. So I was very alarmed at that point, and of course stayed off my feet for the next 3 weeks. So for 21 days, I was literally off of my feet. I couldn't stand up. I was crawling on my hands and knees to the bathroom in my house. The bathroom is just around the corner. It's 10 feet away. I'm staying with a couple of friends right now because the pelvic condition I was treating with was had kept me from being able to work. So at any rate, this has been very difficult. The Cipro, coming back forward now to the Cipro, up to the 28-day mark, the month mark, I was still unable to support my own body weight, and I couldn't walk, and I was beginning to have problems with my wrists at this point, along with my ankles. I thought that it was because I was crawling on my wrists. I might have something to do with it, although I only went to the bathroom 3 or 4 times a day. So I was very alarmed. It didn't feel at that point like I could even take care of myself, and even the most basic hygiene issues like going to the bathroom. So I went to the ER. I had a friend of mine drive me to the ER. I couldn't walk. I couldn't even get to the car. I was going down the steps on my rear, crawling, inching out kind of like a crab, to the car. I get to the hospital, and no, I'm sorry, I forgot. A week before, at 21 days, I went to the ER in an ambulance, and the doctor told me that Cipro wouldn't have caused it. So I'm sorry if I'm losing my train of thought. I still have a little bit of brain fog, which was also one of the gifts from Cipro. So pardon me if I lose my train of thought. At 21 days, after I was crawling around, 3 weeks out from Cipro, I went to the ER because I was very alarmed. There was a good, very bright ER doctor that I had seen in the past for the pelvic condition. He eyeballed, the tendons at that point in my ankles. So there's really nothing they could do. Maybe put me in a nursing home. I'm 39 years old. This was not what I wanted to hear. They couldn't admit me. They weren't going to run any tests. And he even asked me, he said, well, how would you respond if I told you that it's all in your head? That was, of course, that triggered me a little bit. I was not happy to hear that. I came back home, stayed home for another week. So I was at the 28-day mark at this point. It was beginning to move into my wrists. It was not improving. I have had some tendonitis in the past from all the running and exercising. This was much more severe, and it wasn't healing at all. So I was very alarmed. I couldn't but barely get to the bathroom. I was afraid I was going to injure myself even further just trying to make it to the toilet. So I go back to the hospital again. I have a friend drive me in this time. And more or less demanded that they admit me because I couldn't care for myself. They essentially looked at me like they couldn't understand why I was there. The observation of the tendons didn't demonstrate any sort of rupture, at the skin where you could observe it. There was no swelling. So this looks like an injury. When you come to people with it, they don't understand. Tendon injuries are very difficult for people to understand who haven't had them, because it's not like it's as painful as a broken bone or a sprained ankle, but it can result from degradation or degeneration of the structure of the tendon itself. So it doesn't necessarily require some kind of a trauma to the area. A chemical like Cipro, that's exactly what it does. If you look at the research, again, you'll find that it causes, well, I guess the title of one of the articles that I read, these are medical research articles. This is not some second or third source. These are printed, published medical research articles. Bactericidal antibiotics, fluoroquinolones, are known mitochondrial toxicants. And the process, or the mechanism, is very basically that as a chemotherapy drug, understand that fluoroquinolones are chemo drugs as well as antibiotics. They are designed to infiltrate bacterial cells and essentially destroy them from within by, what the term is, transcription with the DNA code itself. generally speaking, they reprogram bacterial cells from within to self-destruct. That's how they operate. The problem is that in those of us who have these negative reactions, and probably a lot more, and people that it's not reported or people that haven't put it all together, but certainly those of us who have symptoms from the drug, what happens is that pharmaceutical dynamic process occurs along with healthy tissue cells, such as that found in tendon, cartilage, connective tissue. So basically what that means is the drug doesn't discriminate, Cipro doesn't discriminate between bacteria and healthy cells, the cells that it should kill and the cells that should be left the hell alone, right? Because those are healthy cells. So it programs your cells and your connective tissue, that's tendons and so forth, your ankles, knees, shoulders, wrists, neck, back, hips, but particularly, as has been documented, in the ankles, in the Achilles, it programs your healthy connective tissue to self-destruct. And that can happen without inflammation. This is really, really important because a lot of people are going to go through this or have gone through this, and they've been through the same thing that I have. I've read a lot of people that have been through the same thing that I have, and they've received a lot of the same responses from the medical community. So that's another reason I'm offering this, to give you some validation on what you're going through. You're not alone. This is happening to a lot of us. It's happening to me. It's been somewhat encouraging and validating to me to read that this has happened to other people, although it's still very frustrating to work through. So I'm in the emergency room, as I said, and because there's no observable symptoms, and I didn't have a history of tendinopathy, naturally they want to run blood tests. If you're lucky, they might order MRIs. If you have some more severe observable symptoms there at the skin, they might order more imaging. But in my case, they didn't. And I was never given MRIs for any of my connective tissue, my ankles or anywhere else, which is interesting. And we'll get to why eventually. But so they ran some blood work. They admitted me in the hospital after I demanded it. The emergency room doctor wasn't going to admit me, and I demanded to speak to the on-call doctor, which is essentially, from what I could gather, in the hierarchy there, is sort of like one of the head honcho doctors on shift that evening. And he came in, I gave him my symptoms, told him that I'd taken the Cipro. He didn't offer that it was even possible that it was a reaction, but he did say that we would admit you to the hospital, Mr. Fisher, and go from there. So within 6 days, I received good care at the hospital. I'm in Western Pennsylvania. I'm fortunate to have the hospital there. The nurses were great. Some of the doctors were very helpful. I don't feel like anyone had it out for me or anything like that. That's not what I'm getting at with this video. But what happened was they ran a battery of blood work and everything came back negative or fine. Everything was okay. This included an ANA test, anti-nuclear antibody test, which is sort of a general test that rheumatologists perform to see if there's further testing needed for autoimmune issues such as lupus or MS, and C-reactive protein test, which is a test that measures markers for inflammation in your body. So they're thinking if this guy has come in with this much pain and he couldn't walk and they had to pick him up off the street, put him in a chair, put him in a bed, then he's probably going to have a lot of inflammation. So that's what they check him for. The problem is it comes back fine. My tests are okay. I didn't have any inflammation. They didn't run any MRIs. They did x-rays on the affected areas, but all my x-rays are negative. So at 6 days, they basically said, you can get some further rehab, inpatient rehab at a facility about 30 minutes away. I didn't want to do that because it was a long drive at that point for me, given the condition I was in. So I just came home. While I was in the hospital, it was also suggested to me that I was somatizing, which is a term for emotionally manifesting physical symptoms, which is essentially like saying it's all in your head. I do have a background, like I said, in behavioral health and psychology, and this was something that I was generally familiar with, and that was also offensive to me because the exam that I got from the neurologist was very brief, and he didn't seem to find anything all that wrong with me. And the orthopedic specialist that came to see me didn't seem to find anything all that wrong with me, other than tendinopathy. I was discharged with the diagnosis of acute tendinopathy and arthralgia, which is joint pain, which I never had joint issues before. And I wasn't really complaining of joint issues when I was there. That happened initially when I took the Cipro. It was tendinopathy predominantly in my ankles and wrists at that point. And keep in mind also at this point, I couldn't use my wrists. My wrists were wrapped up. I couldn't use my phone. I couldn't text. So it was both my wrists and my ankles that were affected. And it was extremely demoralizing, defeating. It was depressing. It was horrible. It was terrifying. And to have the doctors suggest to you that what you're going through is something, they even suggested a psychiatric evaluation, a referral. And they wanted to give me some Ativan, which I declined. Maybe it wouldn't have been such a bad idea to take the Ativan, but at that point, that's not what I was after. I wanted some validation. I needed to hear from some of those doctors that it was at least possible, okay? It was at least possible that the drug that I took that caused this did. I couldn't even get that. I had one doctor ask me again, what if I told you that this is all in your mind? That was one of the ER doctors. Another, one of the physician's assistant, a hospitalist, said to me, and I quote, one Cipro wouldn't cause this. And a third hospitalist said to me that it may not even be tendinopathy because there was no inflammation. But they did give me, like I said, the acute tendinopathy diagnosis. I also had peripheral neuropathy, as I said, electric current, burning, patchy burning, shooting pain, electrical popping and cracking, pins and needles, and I had motor weakness there in my feet. They didn't give me a peripheral neuropathy diagnosis. I believe this is because this is part of the legal game, and you have a better chance of having some sort of a lawsuit if you get a peripheral neuropathy diagnosis, which I wasn't given. At any rate, I had those symptoms as well. With the tendinopathy, the extent of the tissue damage wasn't known because they didn't perform any imaging tests. All of this amounts to, I took a drug that I know caused this. There's no question. I didn't have any of these issues before. My connective tissue progressively disintegrated inside my own body. It was not functioning properly. It was degenerating. It was degrading without any activity whatsoever. And it was incredibly painful, incredibly terrifying. I was treated for 6 days for tendinopathy, which essentially amounted to bed rest, a couple of days of rehab, and at this point I was literally learning to walk again. I had 2 rehab guys on each side of me and a walker in front of me, and it was getting out of bed at that point, which was like a milestone for me, getting to the bathroom without assistance. So I was discharged, basically being made to feel like, or accidentally being made to feel like, if not intentionally, the message that I got was, the drug that you took didn't cause this. You've just suddenly developed acute tendinopathy and you can't walk. It's either all or partly in your mind, but for the part that's not, you should see a rheumatologist. You should follow up with a specialist at that point, which, you know, I'd love to do, but I'm still unable to get out of my house right now. I haven't left my house in 2 or 3 weeks, at least. I can't function right now in the community. I can barely get down the steps. I'm a little bit better than I was. This is some encouragement to you folks that have been floxed. I'm at the 2-month mark. I am beginning to improve with my own sort of treatment. That's included, number 1, of course, stopping the Cipro. If you haven't already done that, do that. Don't take that stuff anymore. Number 2, a lot of treatment given for tissue injury, tendinitis, is a steroid treatment. If you're currently taking steroids for anything and you feel like you've taken, well, you shouldn't take fluoroquinolones while you're on steroids, period. But certainly if you're still taking steroids and you've stopped taking the fluoroquinolone, but for whatever reason you're still on prednisone or prednisolone or any kind of steroid, stop. You should stop taking the steroid if it's not going to, you know, threaten or cause a life-threatening issue. You know, if it's something that you're taking for pain, if there's any way around it, you know, if you're an asthmatic and you have to have it, I'm not advising you to do anything. I'm not a medical professional. But if it's anything that you can avoid and try to go natural or supplemental, you need to do that. You need to stop taking steroids because that will they're contraindicated with the fluoroquinolone. And because this drug cycles out of your system, I can't remember what the half-life is, but the fluoroquinolone's out of your system within a few days. There's only trace amounts left. As I said earlier, it causes mitochondrial damage, which results in oxidative stress in your connective tissue. It can continue to affect you for months or even years. Now, that doesn't mean you're going to have a breakdown a year from now, but that just means you could have issues from this for a while. So you need to be aware of that and stop taking anything that's going to cause symptoms, that's going to moderate the effect of the symptoms, going to make it worse, which is steroids and also the NSAIDs like ibuprofen, naproxen, any of the over-counter, ibuprofen, anything like that. Check with the drug that you're on. If it's an NSAID, stop. NSAIDs are also contraindicated with fluoroquinolones. I know that you want to take it because it helps you to feel better. I used to eat ibuprofen like candy, when I was training a lot. This was up into last year. They would help me, of course, with inflammation and to get loosened up. You need to stop taking those right now while you're dealing with fluoroquinolones. Some people say never take them again. I'm not at that point yet where I can say one way or the other. I probably will try them at some point in the future, but not at this point because I'm still suffering in at least the edge of the acute phase here. I'm not going to take anything that's going to put myself at risk. Stop taking them. That's number one, stop taking steroids. Number two, stop taking NSAIDs. Number three, well, you need to get a magnesium supplement as soon as possible. Now, you're going to go into a lot of websites, you're going to read a lot of research, you're going to find a lot of support groups. They're all going to suggest all these crazy supplements, and I'm sure that a lot of that stuff helps those people. I'm not taking that away from them. But some of it's just, we don't have the money, we don't have the time. I don't have enough time to wait for 2 or 3 weeks for a package to get here so that I can try another supplement that may not even work, right? I need something that's relatively inexpensive that's going to help right now to deal with this issue that I can get at a Walmart or at a GNC or on Amazon in a day or two at my house. It's not going to cost hundreds of dollars. I've read about a lot of exotic treatments like BPC 157. Maybe that's not exactly the right designation, but it's a peptide. It's an injection that you can buy. It's all legal. It's on Amazon. You're not technically supposed to use it as a human, but it works. It helps regenerate tissue faster. There's science behind this stuff, and I have a good feeling that that kind of stuff works. And if you can afford that, I encourage you to try it. I certainly would give it a shot, but you're getting into the hundreds of dollars at that point, So what I'm saying for number three is what seems to work among the population of people that I've followed and been supported by since this has happened is magnesium. There seems to be a relationship between the fluoroquinolones and the presence of magnesium in your tissue. Your body needs magnesium to function properly, and the ciprofloxacin and the other fluoroquinolones cause a magnesium deficiency. So what you should try, which is relatively cheap, is a magnesium supplement. I'm doing about double to triple the recommended adult dosage. The recommended adult dosage per day is 400 milligrams. I do between 800 and 1200 milligrams per day of an oxide citrate blend. These are the more inexpensive supplements. The people that get hardcore into the magnesium will tell you to try some of the other types. There are lots of magnesium supplements available. I will say that it has helped me, and it didn't help me at the daily dosage. I didn't really begin to notice an effect until I doubled to tripled the magnesium intake. I would check with your doctor first. If you're relatively young and you feel healthy, check with your doctor first. Don't just take my advice. I began to feel an improvement in mobility, a decrease in pain, a decrease in neuropathy when I started the magnesium supplement at double to triple the adult dosage. It isn't going to be incredibly toxic at that level. The side effects to 1,000 milligrams of magnesium a day broken up 3 times, morning, afternoon, and night, are probably going to be something like, a laxative effect, certainly for the magnesium oxide. It's not explosive. It's nothing crazy like that. It's just going to be something that kind of relaxes things a bit. But for me, I don't mind it that much because because of the pelvic condition, I was already having some issues anyway. But other than that, I haven't noticed any issues. So you need a magnesium supplement, number 3. Number 4, you need to get your probiotics. Probiotics, the Cipro, is going to have an effect on your gut bacteria. I don't know how much you folks know about that. I'm not going to get all elaborate there. But you need healthy gut bacteria to function in your body. I don't know a lot about that. I just know that it's healthy and it makes a difference. It can have an effect on your cognitive state, your emotional state, and it seems to have a counteractive effect to Cipro to improve that there in your gut. And that can be, you can obtain that with probiotics. You can get it, yogurt. Just check the label. They'll say that there's an active culture and they'll list them. Active yogurt, Greek yogurt, kefir. I'm not sure if that's how you pronounce it, Kefir. There are different stuff in the dairy department at Walmart and grocery stores that you can get this stuff. It's pretty cheap, and you get a dose or 2 of that a day. So that seems to have made a difference. Number 5, I cut out the inflammatory producing food in my diet as much as possible. Diet's very important. A lot of people get hardcore with this that have been floxed. The first couple of weeks, I didn't have any processed food at all. I don't think I ate any grain products at all, nothing like cereal, no granola bars, no bread, no canned food, none of that processed stuff, no potato chips. None of that's really good for you, certainly in the acute phase. If you can avoid it, do so. Highly recommend it. I ate almonds, I ate tuna, protein drinks, protein powder. Keep your protein up so that while you're laying in bed, you don't atrophy too much. You really want to cut that processed stuff out because it creates an inflammatory response that seems to, in many people, exacerbate the fluoroquinolone adverse reaction, the symptoms. It seems to aggravate the neuropathy and flare it up a little bit. You don't want that to happen. So lay off of the bad food, eat healthy. So that's the 5 basic tips that I can give you. Along with the physical symptoms that I was having, I was also having a lot of emotional issues. I was very upset. I was sad. I cried a little bit. I was afraid. I couldn't think straight. I felt like I was in a brain fog those first 2 weeks. Just like a fog had come down on my mind. I couldn't focus. I couldn't think straight. It was blinding pain, but there was this cognitive sort of bludgeon over my face. I couldn't really make any sense out of anything. That went on for a few weeks. I also had, I wouldn't call it intracranial pressure, which I'd never had before. It felt like my head was in a vice. It was being pressed. And that went on for the first 2 weeks. I also had a couple of really bad headaches, and my eyes were tearing up. They felt salty, like there was a chemical coming out of my eye or something. This was all going on for the first 2 weeks along with everything else. It was a real nightmare. I will say now at 2 months that most of the cognitive stuff has disappeared, even after 2 weeks. A lot of that stuff, it was the first to go. I did have some tachycardia